instead you spend your days working for a CEO who has never laid hands on a patient in their life, but wants to tell you how to do your job. And you spend all of your day charting. And yeah, I just couldn't do it anymore. We were in New Mexico at the time. We were relocating to Texas. And I was trying to figure out what I wanted to do. And it was actually a Facebook ad that came to me and said, primary care physician takes home $400,000 a year and is home in time for dinner. And that clickbait worked like a charm, my friend. It's like, what? This isn't real life. And so it was all about this model of healthcare called direct primary care that I had never heard of before. It's basically membership-based healthcare where your patients pay a monthly fee, much like a gym membership, and then they can come in as many times as you want. You take the insurance company completely out of it, so there are no restrictions. When it's fee for service, if you're not sitting in your chair seeing a patient, you're not making money. Where with a membership basis, our revenue is always there, whether I see you or not. And so I dove into this and I was like, what is this? And I went to my husband who has an MBA. And by the way, I didn't even know what the word entrepreneur meant at this point. Like I had no idea because I have no business running a business. And I went to my husband and I said, I want to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. And John, I'm not joking you, he laughed in my face. And he was like, Monica, that's not real life. And he said, okay. So we moved to Texas and I opened a practice 3 months later. Or I'm sorry, 3 weeks later, knowing no one. I didn't have a patient following. I had to convince people I knew what I was doing, but I was all in. And I really was doing it to give myself a job that I loved. And that was the beginning of it. And so I've always had this passion that I want direct primary care to become the norm, not the exception. It is membership-based healthcare that is literally going to fix our healthcare system and go tell somebody about it, because that is my ultimate goal.